welcome back to Body Beautiful. I'm Janelle Marie. With us today, we have plastic surgeon Dr. Joseph Mealy. We are talking about a bunch of different topics. Next up on the docket, we've got breast augmentation revision surgery.
Okay.
First off, breast augmentation.
Yes.
All right. Why do you need to have it revised?
Most common reasons to have it revised are changing size of the implant, which is usually completely volitional, nothing wrong with it.
Okay.
Problems with the scar around the implant. So in order for an implant to stay in place, the body makes a little capsule, a little pocket of scar. If you don't have that, it's a problem. So you definitely need that. But if the scar gets too tight or too thick, it will distort the implant.
Okay.
So it'll make it look smaller, project more. Sometimes it looks angry, red. It starts to affect circulation in bad cases.
Okay.
And then we go in surgically and release that scar or remove it. And that way the process can start again. Hopefully we get a better scar the next time around.
And I know that breast augs can either go under the muscle or over the muscle. Could there be a problem with that? Maybe it wasn't supposed to be under or over, or do you know exactly where to put that implant first time?
I think the implants tend to look better under the muscle because it tapers that upper pole, gives more of a teardrop shape. There are exceptions though. If I have a patient who's a bodybuilder who's posing in a bikini, when they flex their muscles, it pulls the implant up and out.
Right.
So we get less of a flexion deformity if we're in front of the muscle. The downside to that is it looks like half a coconut. I mean, it looks very obvious that there's an implant there. And if you look at the covers of the muscle and fitness magazines, the women who have implants, it's fairly obvious that there's an implant there.
And what about scarring for breast aug revision? Do you follow the same scar? Do you make that different? How does that work?
Most of the time. If the scar is in a good place, you know, the most common scar is now underneath the breast. That you can use over and over and over, and it doesn't tend to cause trouble. It gives us great access. I can get to the whole pocket. You know, if the implant is leaked, that's another reason we revise them. And the gel is escaping, so if it's an older implant that doesn't have that cohesive gel, that gives us enough of an opening to get in there, clean it all out, and you know, try to remove as much as possible. The scar around the nipple, sometimes I don't want to use that again, because going through it repeatedly, sometimes it will tether and pull in a little bit, especially with the muscle flexing. Scars in the belly button and axilla usually are not great scars for revisions, so I try not to use.
It brings me to a good question. You know, what happens if a scar just doesn't heal properly? And I'm sure it happens.
That's about 1% of the time.
Okay.
We'll get a scar that's either hypertrophic or colored or vascular, and there's a lot of things we can do while it's healing to try and encourage it to behave.
Okay.
Simple things like massaging, topical treatments. Vaseline actually works pretty well. It keeps the scar moist.
It does
and
everything.
Happy. And it's cheap too.
It's cheap.
Not usually the way the world works. Silicone sheeting and silicone topical also help. If scars are red, lasers can help with that. And if after a year it's had a chance to heal and it's still kind of angry or not happy looking, then sometimes we have to redo it. So cut it out, close it again. But without the other surgery going on, you know, we can do less of an injury, cause less of an injury, and hopefully get a better scar.
But you watch it and make sure it's good. Let's go to pick number one.
No, the follow-up's very important.
Yes.
You know, sometimes people want to fly in, get something done, and disappear. And you know, I can't follow the scar. I don't know what exercises to tell them to do. It's just a lot easier if it's someone nearby.
Absolutely.
And if there's trouble, they can just come in.
Absolutely.
So, obvious problem here.
First picture.
The right side has capsular contracture.
I can see that.
Which has pulled the implant up, tightened it. It looks a little bit smaller. It's firmer. If you push on that side, it's quite hard.
So it's a little hard. Okay.
So what I've done is gone back in, release that scar, actually remove the entire scar there,
that looks
drop
really good.
the implant back into its proper position.
That's perfect.
And I think we just left the same size implant. Sometimes we'll adjust the size of the implant.
That looks really good, the after picture. A second, I can see the scars here.
So here's someone that had kind of an angry scar.
Oh, yeah.
And it was red and vascular, and this was a mature scar.
That was a mature scar.
She also felt like she was a little big, which was great because her left breast has bottomed out a little bit. So going to a smaller implant really helps keep the repair intact. So we've reduced the size of the implants, redid all the incisions in order to get a better scar.
And so that scar looks better just because you took volume out?
The scar looks better because we redid it. So I basically excised the scar and closed it again.
All right, third picture.
It could have done the same thing again, though. I don't have control over how the body heals.
It's not angry that time, though. It looks good.
Yes. So same idea here. We have a little capsular contracture on the left, a little bottoming on the right.
Yeah, not too bad.
Both sides have been
revised. That looks so good, though. The after picture is perfect.
Well, you want it to be even. And you know, I would like, if we were made out of stone, I would like it better because it will stay that way. But breasts are soft and squishy.
That's true.
And
you want them
when
to
you
stay
put them
that way.
together, they want to move. And as we age, they change. So if we can at least get them starting in a good place, the chances are good it'll stay that way for longer.
We have another picture? Yes, we do.
And lastly, again, little tightness both sides, but if you notice on the left side it's really small.
Yeah.
It deflated. So this is a saline implant with a little capsular contracture on the right, deflation on the left. Both sides have been replaced. I think I upsized a little bit too.
Are there some you just cannot revise? Some problems?
There are some problems that are very, very difficult to revise, and often what we'll end up doing is removing the implant, letting everything heal,
Gotcha.
and then coming back at a second stage and trying
Taking
to
a
revise
whole
it.
nother look at it.
Yeah.
All right, great pictures. For more information about Dr. Mealy, you can call 925-943-6353 or check him out on the web, drmealy.com or sanfranciscobreast.com. All right, we'll be right back talking more about plastic surgery with Dr. Joseph Mealy. Stay tuned to Body Beautiful.